So ever since the advent of competency-based medical education, there has been a lot of confusion amongst both the faculties as well as the students as to what is a competency, what are objectives, how to proceed about learning a competency, how to go about reading a subject, and so on and so forth. So in this video, I shall be discussing the Pediatric Competency 30.8 of the MBBS curriculum, which states defining epilepsy, discussing the pathogenesis, clinical types, presentation and management of epilepsy in children. But prior to this, I would like to take a moment to thank every one of you who is a part of my endeavor for child health. And of course, this channel helps you to clear your concepts and to keep you updated. Thank you everyone for all the motivation and all the kind words and all the love and affection that you have showered upon me over the years. And this keeps me motivated to make more and more videos for young people like you. So the first objective is to define epilepsy. So epilepsy is defined as more than equal to 2 unprovoked seizures occurring 24 hours apart. So there are 4 important things in this definition. First is that the seizure should be more than equal to 2. They should be unprovoked, that is there should be no provocation, no known provocation or no known clinical or laboratory risk factors when the patient developed seizures. Then there should be seizures. Seizures, what are seizures? Seizures are excessive abnormal electrical discharges in the brain. We know that normally there are electrical discharges in the brain and this leads to certain functions of the brain as well as the body. But when there is an upsurge and these electrical discharges become abnormal, then they result in what is known as seizures. The fourth part is that these should be at least 24 hours apart. So as regards the definition of epilepsy, they should be more than equal to 2 seizures, which should be unprovoked and should be occurring at least 24 hours apart. The next objective is describing the pathogenesis of epilepsy. So we know that the entire body has cations and anions which are there in a state of homeostasis. So whenever there is a disturbed extracellular ion hemostasis, that is the hemostasis between the cations and anions is disturbed, then in that case there is altered receptor functioning of the neuroreceptors. Neuroreceptors, they function in a disturbed manner and they lead to differential uptake of the neurotransmitters. So neurotransmitters, as we all know, they are of 2 types. These are the excitatory and the inhibitory neurotransmitters. Excitatory, for example, glutamate, and inhibitory, for example, GABA. So if there is an imbalance between the uptake of glutamate and GABA receptor, then there can be a possibility that the glutamate levels are increased and the GABA or the inhibitory levels, neurotransmitter levels are decreased, and this is what is the pathogenesis which leads to seizures. Though this is not mentioned as an objective in this entire competency, I have included this to cover the topic in a whole. So when we come on to the etiological categories of seizures, we see that seizures can be due to structural causes, for example congenital malformations. They can be due to infectious causes, for example CNS tuberculosis, of which you see a radiological CT image of this. Then they can be due to genetic causes. They can be due to certain immune causes, for example autoimmune encephalitis and acute disseminated encephalomyelitis. Then they can be due to metabolic causes. Metabolic causes most common is hypoglycemia. Then it can be due to hypocalcemia as well as due to renal and hepatic dysfunction. Then there can be vascular causes, the most common of which is stroke. And finally, certain causes are there which are idiopathic, like the exact etiology we don't know till date. The next objective is to classify the clinical types of epilepsy. So as regards the International League Against Epilepsy, which is the standard body for matters related to epilepsy, the classification which was given in the year 2019 and which is the latest classification given by the ILAE 2019, any type of seizure or any type of epilepsy should be, everyone should attempt to define seizure or an epilepsy under the following headings. The first is the type of seizure. Second is the type of epilepsy, and third is the epilepsy syndrome. So when we see what is the type of seizure, the seizure type has been defined on the basis of onset. So if the onset is generalized, then it is referred to as generalized onset seizures. If the onset is focal, it is referred to as focal onset. And if the onset of seizure has not been noticed by the patient properly, then in that case we may simply label the seizures as seizures of unknown onset. Here I would like to clarify one concept. Generalized means both the hemispheres, both right and left hemispheres are involved, and focal means that one hemisphere is involved either partially or totally. So this is a common misconception amongst the students, that generalized means the entire brain. No, it is not the entire brain. Maybe it is a part of the brain, but symmetrical in both the two hemispheres, and focal is involving only one hemisphere. Next is the type of epilepsy. Now the type of epilepsy can be generalized epilepsy. There are four types of epilepsies. First is the generalized epilepsy, of which we see the following five kinds of seizures can be there. Generalized tonic-clonic seizures, generalized tonic seizures, generalized atonic seizures. Atonic seizures are simply the patient is standing or sitting and all of a sudden he loses tone of his body and his body falls on the ground. This is also referred to as drop attacks. Then myoclonic seizures as well as absence seizures. Many students confuse absence seizures to be a part of the partial seizures, but absence seizures are actually generalized seizures involving both the two hemispheres. The other type of epilepsy is focal epilepsy. The type of seizures seen in focal epilepsy can be focal impaired awareness seizures, focal aware seizures, focal motor, focal non-motor, and focal bilateral tonic-clonic seizures as per ILAE 2019. But at the MBBS levels, you don't need to remember these three kinds of seizures. What you must know is that focal impaired awareness seizures, in which the consciousness or the sensorium gets disturbed, and these were referred to as partial complex seizures earlier. Then focal aware seizures referred to as simple partial seizures earlier. For the faculty who have been of our times, because the latest classification of epilepsy has changed. The third category is combined generalized and focal epilepsy, in which you can get seizures of both focal and as well as generalized type. And the fourth kind is epilepsy of unknown onset. Next, coming on to defining the epilepsy syndrome. Now, what is a syndrome? Epilepsy syndrome is a certain age, certain clinical features, certain EEG findings, and certain neuroimaging findings, and response to certain types of drugs occurring together in few patients. This is referred to as epilepsy syndrome. For example, benign epilepsies of centrotemporal regions. So the epilepsy syndromes are of basically two types. These are idiopathic generalized epilepsies and benign epilepsies. You don't have to go into the details of all these kinds of epilepsies at the MBBS level. But idiopathic generalized epilepsies are, for example, childhood absence epilepsy, juvenile myoclonic epilepsy, and benign epilepsies are, for example, Paniotopolis syndrome and benign epilepsy with centrotemporal spikes. Then, coming on to describing the various presentations of epilepsy, we see that the clinical presentation of epilepsy depends on the type of seizures and the type of epilepsy. But besides this, the patient can have certain deficits as well. And what are these deficits? These deficits can be motor deficits, for example, abnormalities in tone, which is very common in patients with cerebral palsy. Then mental deficits, which include language, behavior, and psychological abnormalities. And then comes on to the focal neurological deficits, which comprise of visual and hearing impairment, which may or may not be present in every patient with epilepsy. The next objective is to enumerate and describe the various investigations required to diagnose epilepsy. So here I would like to reiterate that the diagnosis of epilepsy is purely clinical. You have to take the proper history, see a videographic evidence to see if whether or not if it is a seizure or the child is just feigning. But this should definitely be supported by EEG and neuroimaging findings, because EEG helps you delineate the further categorization of the seizures, and neuroimaging findings help you to identify the etiology. But besides this, for etiological workup, you also need to do certain other investigations, for example, CSF analysis in case you suspect an infectious or immune cause, or you may have to go for blood sugar, ionized calcium values, LFT and RFT for metabolic causes, so on and so forth. The next objective is to outline the medical as well as the surgical management of epilepsy for MBBS students. So the medical management comprises of two parts. First is the management of the acute episode of seizure, and second is the long-term management. So as far as the management of acute episode is concerned, we administer the first line anti-seizure medications, which are benzodiazepines. And as far as the long-term management of the seizures or epilepsy is concerned, we generally start from the second line anti-seizure medications, which should be continued for a minimum of 2 years seizure-free period. 2 years seizure-free period, followed by gradually tapering and stopping the anti-seizure medication. Then coming on to the surgical management. Surgical management is indicated in patients in whom epilepsy is resistant to anti-seizure medications. The type of surgeries which are done are resective surgery, laser therapy, deep brain stimulation, corpus callosotomy, hemispherectomy and functional hemispherectomy. You just have to know the names. Now I would like to share something about this deep brain stimulation, which you must know, because it is not a typical surgery. In this, a permanent device is placed inside the brain which releases regularly timed electrical signals, and these electrical signals disrupt the seizure inducing electrical activity, and the generator which sends these electrical pulses is implanted in the chest of the patient. Then what are the common anti-epileptic drugs and the types of epilepsy in which they are indicated? So I have discussed the 5 common anti-epileptic drugs which you must definitely know at the MBBS level, and it is very commonly used at the MD level as well. You must know about these, at least these. So these are valproate, which is a broad spectrum anti-epileptic anti-seizure medication, which means that it can be used for both generalized as well as focal seizures. Then comes the levetiracetam, which is a slightly newer anti-epileptic drug. It is also broad spectrum. Then comes phenytoin, which is primarily given for generalized seizures. Then comes phenobarbital, which is given for neonatal seizures as well as refractory seizures. Finally comes carbamazepine, which is the drug of choice for focal seizures. Now, enumerating the side effects of these commonly used anti-epileptic drugs. The common side effects of valproate include weight gain, tremors, hair loss, gastrointestinal upset, cytopenias, hepatic or pancreatic injury, osteoporosis, birth defects, which are seen in up to 10% of patients, and they can be prevented by administering folic acid to the mothers antenatally and antenatally and before conception. Next is levetiracetam. The common side effects are dizziness, fatigue, insomnia, irritability and mood changes. Then comes phenytoin. The side effects associated are unsteadiness and moderate cognitive problems, body and face hair growth, which is referred to as hirsutism, skin problems, osteoporosis, gum hypertrophy and Stevens-Johnson syndrome. Then comes phenobarbital, which has side effects of sedation, thinking or memory problems and depression. And finally comes carbamazepine, with which you may notice gastrointestinal upset, weight gain, blurred vision, cytopenias, hyponatremia and again Stevens-Johnson syndrome rarely. So thank you so much for a very patient listening and watching, and please do share the video for maximum benefit of most of the students, which I am sure will be benefited by all. Thank you. Thanks a lot.